Good afternoon and welcome to the Health and Human Services Committee meeting. Today is Thursday, December 12th, and it's 1 p.m. I would like to call this meeting to order. We do have a few changes to the agenda that I would ask our committee members to approve. For one, I would like to add a resolution to our agenda, and that's Resolution 12981. Resolution expressing concerns regarding the rollout of the New York State Department of Health Early Intervention Hub. If I could get a mover to add that to our agenda. Moved by Travis, seconded by Randy. And I definitely apologize to our staff as well as Frank and Whole Health, because I sent this to him about 45 minutes ago and was able to get the thumbs up, and our staff hurriedly added this, printed it up for us. So thank you so much. I'm sorry to put all of you welcome you into my chaos. So sorry about that. All those in favor of adding it to our agenda? That is unanimous. Thank you. Also want to add a conversation piece. We have some of our friends from the library that are here to talk about the opioid settlement funds that they received, and talk to us about their programming as well as the vending machine that's in the library. And so we'll add that as one of our talking points. And let's go ahead and move on to public comment. And I have, let's see here, I only have one blue card, or two blue cards. And I also have one person that mentioned she was going to join us remotely. So why don't we start with our blue cards first? I'll just go over the rules of speaking under privilege of the floor. Number one, I agree to a three minute time limit. Number two, I agree not to raise my voice. Number three, I agree not to use lewd, obscene, profane, slanderous, or libelous language or speak or act in a manner that would tend to incite a breach of the peace. Number four, I agree not to speak about county personnel matters. Personnel matters include comments about the job performance of named county employees other than elected officials. Number five, after 3 minutes, I agree to leave the microphone and yield the floor. Transferring time to another person is not permitted. Number six, I agree to be courteous and not make comments, gestures, outbursts, or other disruptions with other members of the public or legislators while other members of the public or legislators are speaking. I think we have a typo there. I agree that if I cause a disruption and am asked to leave, I will leave the chambers. First person up is Amanda Kirch-Gessner.
Hello, I missed two microphones. That's just a nice touch. Good afternoon, I'm Amanda Kirch-Gessner. I am here today to share a couple things, but mostly on your agenda is a discussion about accepting a grant from TANF to create some family care managers at DSS. I don't know how much time you spend at DSS. Some of the workers are great, some really struggle with their caseloads. I would strongly discourage the creation of these new case management positions unless the funding is really clearly in order and that they're going to be funded for 5 to 10 years with resourcing that won't fall.
You might want to stay like 6 inches away.
That won't fall on the county's budget. Like, grants are great, but not necessarily when it comes to creating new positions. I also, having dealt with some of the clients I've been volunteering with lately, it's very important that every individual has their own personal care manager so that everybody's needs are considered as we navigate these complex systems. And family care management just seems like a disaster waiting to happen, and could easily be prevented by not seeing it through, at least not right now. Additionally, I did send an email to the legislature about an issue with Code Blue. Like, generally, everybody there has been amazing, from the staffers to the security to even the guests. But there is an issue. I believe you've all seen the Ithaca Voice article about the individual who died a block away from the shelter. From the relationships I've built with the folks who are staying there, one of the individual claims that they tried to help the person get to Code Blue, gave them their sleeping bag, and informed Code Blue staff that this individual was outside and nobody was dispatched to look at it. So if this did in fact happen the way the guest shared with me, this is something that could have easily been prevented if we had been slightly more attentive in our care response. These individuals know that they can reach out to me, but a lot of them don't have functional phones, and I would have gone out and checked if I had known, but because they don't have Wi-Fi or devices that allow them to communicate with people who will hear their concerns and give them attention, somebody died, and it could have been prevented. You know, otherwise, Merry Christmas, Happy Holidays. I'm glad we're all here today. You know, a moment of silence for Roland Hoyt might be in order. And I pray that people actually want to receive the help that is being offered, and that we actually want to work together to get this figured out, because it's really not that complicated. $25 makes a world of difference in the day, in the lives of people who don't have anything at all right now. Thank you.
Thank you, Amanda. Our next speaker is Joshua Fenton.
My name is Joshua Fenton. Sorry about that. What I've been dealing with this area is what was it called?
The fire alarms or the unsafety,
Yeah.
like the domestic violence that you see? All of that, you can see any of that.
Well, what I've been noticing with domestic violence is people have been putting their hands on women, ladies, which I should not appreciate seeing. And in fact, personally, I just want to get out of there so I have another place to live. But it's really not happening because all the fire alarms been going off and all the police interactions been happening there, which I don't want to live there much longer. So it's kind of hard for me to do that and live there at the same time. Yeah.
Well, no, you stay here. One thing, Joshua called me yesterday because there was a fire alarm, and there's false alarms there all the time, so people don't even listen to the alarms, which means that if there actually were something more serious happening, how many people would die in that building because they have been conditioned to think that the alarms aren't real. And I love Josh. He loves the fire department. The guys there know him well. But we have a serious health and safety issue on our hands, and we really need attentive help from the people in positions who can actually make these changes happen. You want to say anything else?
No, that's about it.
You're good for now? Or you yield the rest of your time?
Yeah, Merry Christmas, all you guys. Hope you guys have a good Christmas.
Thank you, Josh. It's good to see you, and I hope you come again. Okay, next we have a request for an individual to join us via Zoom, and she is not in our lobby. If we see her pop up through the meeting, then we're happy to hear her. So let's go ahead and move on. I would like to move the resolution that we added up in the agenda. I believe Jessica is here from Whole Health, and she's able to add a little bit of background to the resolution. If I could have a mover for resolution 12981, moved by Travis, and a seconder, seconded by Amanda Champion. And I am able to talk a little bit about why I decided to write up this resolution. A few weeks ago, I was approached by a local provider here in our county who has been doing early intervention and working in our schools for a very long time. And she had concerns that New York State had a new platform, new software, and she also aired the grievance that she had not been paid in 10 weeks. And so we did have a conversation about this at the Board of Health. Jessica and Frank both sent me some information. And I did forward it on to her. However, my assumption is that other providers are also experiencing some of these gaps in payment and frustration with the new system. So Jessica and Frank, I am sorry that I sent you this resolution so late, and I would love it if you could add some backstory and/or corrections to anything I might have put out there.
I'll start and then turn it over to Jess. Yeah, so the New York State Department of Health has instituted something called the EI Hub, which is a new platform for providing information about services and connecting to the billing mechanisms. It's been a struggle for quite some time, and in fact, NYSHO, the New York State Association of County Health Officials, lobbied for and got a delay in implementation. Because there were so many concerns about the system and its test form. Ultimately, we got to the place where they launched it, and it has created problems, as you would expect with any new software system. Initially, the system was very slow. They've worked to improve that, so we have seen some improvement there. There are let's call them less than user-friendly processes in the system with bugs that have made it difficult for folks as well. I will say there was a lot of training offered before the launch for both counties and providers. And honestly, I don't know how many folks took advantage of those trainings in preparation. And understandably so, right? We've had the conversation about rates for early intervention and them not being sufficient. And those providers were being asked to do additional training and prepare for a new system with no additional support financially for that work that they were going to have to do. So the system is flawed. There is no doubt there. I will say every time we talk about early intervention, folks are probably tired of hearing me say it. There is a flaw, a foundational flaw that rates are too low. They are too low for the type of service, the professional credentialing that's required to do this work, and quite honestly, the time it takes to travel from home to home to provide these services, it just isn't sufficient. I want to thank the legislature for your support in allowing us to provide a stipend, because that has helped. But the counties around us are struggling greatly because of that. And I fear this is just a Band-Aid at the moment. But I will stop talking there and let Jess talk about her experience with the hub as well.
Yeah, hi, thank you for the invite today. I agree. Obviously, everything that Frank said is gone on, accurate, correct. We at the county, we had spent months of training, in person, virtual, and one-on-one training with PCG, who developed this database prior to the launch of it, knowing that it was crucial for us to learn it in order to continue services for our kids in the county, and also be reimbursed as well as a municipality. So we were thankful to be offered the trainings to be able to do that. As Frank said, I'm not certain that everybody was able to attend those trainings, specifically provider groups, because they were continuing to provide services for the children. But it does create billing issues for them at this time. The state has offered some assistance when hearing from the provider group regarding payment and billing. They have lifted some of the most common billing errors that are occurring in order to push those payments through. And they have also offered a contract that providers can enter to receive some payment during this time until they get their billing up to date. We at the county are continuing every day working in the system, learning all of the functionality that it takes to successfully move a child through the system and bill. We have spent about 90% of every day troubleshooting EI Hub functionality and issues that arises. We are in communication with New York State Bureau of Early Intervention and PCG on a weekly basis to talk through our major challenges. They are responsive, and there have been some fixes to some of the issues that we have been seeing. Moving forward, once we are at a better place at the county and feel more proficient in using the system, we hope to allow for a group meeting with our providers in our county to see how we can work together to make sure we can successfully get children the services they need and document according to regulation.
Great, thank you. Any questions for Frank or Jessica or comments? Randy?
Yeah, thank you, Jessica. You said 90% of your time is just working your way through the system itself. Is that so that the county can actually do billing as well?
That is correct, yes. A lot of what we're finding, which is causing most of our time in the system, is the children's data that migrated from the old system to the new system is where a majority of our issues are coming in with billing. So yes, that is correct.
Thank you.
You're welcome.
And I will probably offer an amendment whenever it goes to the legislature. I just heard back from Anna Kellis, and one thing that she added was that she would add a whereas that would also urge the Department of Health to comply with this year's state budget that authorized an increase in reimbursements by 5%. So I'll probably add that as another, probably as a resolved. So just to let everyone know, I'll be adding an amendment.
Shauna, I would suggest if we're going to go that route, we should also talk about the insurance contribution. They set up a new program where insurance were required to give a certain percentage to the state that was then supposed to be distributed to counties. Counties have not seen that in 2+ years.
Okay.
And so there are multiple things on the financial front. If you'd like to add, we can help.
Yeah, we'll get together, Jessica and Frank, and come up with some language for that, and we'll do a substitution. So awesome. Thank you for your help on that. And Amanda?
Well, just so, this won't go to next week's meeting, would it?
It is time
Oh,
sensitive,
okay.
and so I'll add it as a member filed.
Okay, all right. So it wouldn't go on the consent agenda, you'll add it?
Yeah.
Okay.
Yeah, but I did want the committee to weigh in, and, we'll push it through despite the fact I'll add it as a member filed too.
Okay.
So, okay. All those in favor, please raise your hand. And that is unanimous. Thank you all. Let's see here. Moving on to my chair's report. I just wanted to mention that next month we're going to wrap up being on this committee for a year. And so I would like to bring forth our priorities that we started a year ago. I think I took a glance at them earlier this morning, and I think we've been able to address many of those concerns. I think some of the upcoming focuses are probably going to land where they were this year on mental health, substance use disorder, and sheltering. We received a fiscal outlook from our partner NISAC, and I did put a copy of that in everyone's mailboxes, but there were some concerning parts that actually deal with our Health and Human Services Committee. And this, by the way, NISAC is nonpartisan, and so the information that's provided, typically is not political, but there were some concerns coming up in the next year, one of which was Medicaid. They talked about Medicaid setting a hard dollar cap on existing spending levels or cutting it back with no federal support for any growth. Also ending or reducing the Affordable Care Act, which I know for our county has actually been really helpful for many people. It's lowered the eligibility standards for many people that work in our area. So they've been eligible for Medicaid and other insurance. The other part that could happen is that reforms can include that all states require recipients to work to maintain Medicaid benefits, and that we would lose our federal match if our recipients fail to do so. One of the other concerns that I saw was the TANF and other income assistance. The TANF currently has been operating under a block grant since 1997 with very few changes. And right now, New York State receives $2.8 billion and 40% of the nationwide TANF grant. And right now, there's concern that that TANF contribution to New York State could either decrease or be cut completely. And, you know, as we all know, TANF contributes to some of our housing and pays for some of our individuals' housing. The other concern that we're going to have is our SNAP benefits. There have been proposed cuts to SNAP that we're aiming to reduce the program's budget by tens of billions of dollars. And so SNAP is used by, again, many of the individuals that live here in Tompkins County, and I would hate to see that program not be part of what we're able to offer. So I just wanted not to get overly depressing or doom and gloom. Deborah Dawson isn't here, so I felt like I had to fill in for her. But I think these will probably be things that we need to communicate about and really be aware of over the next year. Let's see here. Bridget is here for our county administrator's report. Bridget, do you have any comments?
Thank you, Shauna. Yes, just one comment, although I do not see him on the screen. On behalf of county administration and the county administrator, we did want to acknowledge Dr. Clark, the director of the Office of Human Rights. He has announced that he will be leaving his position with the county as of the end of this calendar year. And given that this is the last HHS committee meeting of the year, we want to make sure we acknowledge him, thank him for his many years of service with the Office of Human Rights. And we will be updating the legislature and the community soon on the direction of that office in the near future.
Thank you, Bridget. And a big thanks to Dr. Clark. He stepped in as our director of the Office of Human Rights whenever that department was really going through a lot of turmoil. And I can honestly say that Dr. Clark has grounded that office and really done some great things and had some great programming over the past 6 years?
I believe 7, maybe
7
8.
years.
Yes.
Yeah. I guess it was right when we started. Yeah. So thank you, Dr. Clark. Your commitment to our county has really been incredible, and we thank you for your service.
Thank you, Shauna. That's all I have.
Okay. Any questions or comments for Bridget? Okay. Next, why don't we actually go to our friends from the library? We have Sasha and Emily. Or Currie, sorry. Would you all like to come up and talk about your opioid settlement funding and the great things you're doing at the library? Why is it Emily?
Yeah,
Sure, go for it.
So, hi, I'm Sasha. I'm the program manager for Information Saves Lives. We've had so far this year 2 programs and 2 major events that were all really exciting. We had 2 book clubs, and our events were our Harm Reduction Resource Fair in October and our Narcan vending machine ribbon cutting, which was just 2 weeks ago. It feels longer. Feels like a lifetime. The Narcan vending machine especially has been such a wonderful resource already. The weekend that it was put in place, there was a gaming convention at the convention center across the street, and a group of maybe 12 people came in from the gaming convention from out of town, saw the vending machine, and were talking about how much they love libraries and how, this is just such a wonderful thing libraries do, and then all got Narcan and took selfies with their Narcan, which was a choice. And another wonderful thing was after the ribbon cutting, I was out and about actually getting craft supplies for our holiday crafternoon when a member of the community recognized me from the resulting media from the ribbon cutting, and told me how excited she was to see that because you her and her entire church group had just gone together to get Narcan trained. So it's that kind of like really wonderful interactions that we've had that reinforce how important this grant has been, and how thankful that we are to receive it and work with it.
And if I could jump in too and thank the county for especially the wonderful video that they put together. We've been reaping all kinds of benefits from that. One wonderful thing that we didn't expect that did come out of this was an anonymous donor who had never given to us before happened to catch some of the coverage, had some personal experience with...
I'm sorry to interrupt. Can you get a little closer to the microphone, please?
Sure, sorry.
Thank you.
We had a donor who, because of the coverage that we had, came out and made a significant gift that they want to be able to have the program continue after the grant funding has completed, and has never given before, wants to remain anonymous, but is part of a support group for parents who have lost children. Have noticed in the past year, several of them have lost children to fentanyl. So it's great for us, I think, to see that the public and the private support is going to be coming as a result of this, so we can continue doing this as long as we have to.
Wow.
Anyway, thank you for helping us spread the word and to get that in front of generous people.
Any questions or comments? So I will say that, I mean, I think we all know in this room that Narcan saves lives. And it's interesting because I did see the Ithaca Voice article, and I thought it was very well written. And your ribbon cutting, I think, was well attended. And you know, I was excited that you did that. It's still so interesting to me how many people are still unaware of how substance use disorder, how it happens, how it could be anyone's loved one, how it doesn't discriminate. Yet I read some of the comments on Ithaca Voice, and it doesn't, I tell myself, don't even look at them. And, you know, I've also been the one that, you know, goes round and round with people, and, you know, sometimes you're not changing people's minds on Facebook, let's be honest. But, you know, I think, you know, for me personally, I think we have to just keep getting out there. We have to keep doing the things that we know are evidence-based and work and save lives. And so thank you to the library for stepping up and really providing the service. I know individuals that have gone into the library that have used the vending machine. One of the conversations we had in the task force was also offering fentanyl testing strips in those vending machines, or are we, do you have them available?
They're in a, you actually don't need to use the machine to access those, excuse me. There's a small box that is right at the output of the machine that has those, but then we also have them distributed in the bathrooms and the teen area, all throughout the reading area, so they're all throughout. They're bright green, you can't miss them.
That's great.
So they're all throughout.
Yep, great, thank you. Travis?
Do you often have to replenish the testing strips? Do people seem to be using them?
They definitely seem to be using them. We have both fentanyl and xylazine testing strips available. I have personally noticed that the xylazine testing strips actually tend to go faster.
Okay. Thank you.
Wow. Great. Well, it would be wonderful to have you back reporting because I feel like this is, you know, this is a powerful program, and I'm glad that we were able to get the settlement money. It certainly doesn't replace the lives that have been lost over the years, but I feel like it can definitely make a difference. So thank you.
Thank you. And one, you know, I know you commented there were, you know, some loud negative responses, but there were also equally positive responses. And my favorite one was someone who reshared the story, who just said, "I love it when we get it right."
Yeah,
I think
that's
that,
right.
that really does it. So thank you.
Great. Thank you both.
We also have just, so we have some tote bags with all of our like advertising materials in them, including our program sheets. So I can leave some of these here for all
That's
of
great.
you.
Yeah, sure. Thank you.
Support chair. Thank you. Thank you so much.
Appreciate it.
Thank you.
Enjoy your holidays.
You too.
Okay, moving on to the Department of Social Services. Let's see here. I see that Kit is joining us today. Hello, Kit. Welcome to
Hi, Shauna. How are you?
Good. How are you?
Good.
let's see here. Why don't we go ahead and do the resolutions, the two resolutions we have. We'll start with Resolution A, a budget adjustment, Department of Social Services, Family-Centered Case Management Services, Temporary Assistant for Needy Families, Grant Acceptance and Authorization to Hire Appropriate Staff, ID 12969. Can I have a mover, please? Moved by Travis, seconded by Randy. And Kit, would you like to talk to this resolution?
Sure. So this, we're excited about this. OTDA has come up with money and sent out a directive to communities to allow for a family-focused position or positions that will provide case management for people that are in shelter. So the goal is permanent housing, really looking at working with families. I think that as we all know, not that long ago, a decade ago, we didn't see families in shelter for the most part. We saw single individuals, and we're really seeing a change. Currently, we have 12 children in a number of different families in shelter, and that is pretty consistent. Now we are seeing a pretty good group of families, anywhere between 5 and 7 families at any given time in shelter. So this will be a case manager that will really be working with people who are in receipt of TA and that are in need of permanent housing, trying to facilitate them moving out of shelter and not lingering in shelter. Children in particular should not be in shelter. It should be a brief thing and people should be moving out and getting resettled. So that's the goal of this. We have a senior caseworker position proposed, as well as a case aide that would both assist with this work.
Thank you. Any questions or comments? Randy?
Hello, Kit. Is this a one-year grant, and do you think it will continue, or?
So I do think it will continue, Randy. I mean, one of the things that I think we always have to recognize is we don't know. It is only guaranteed right now, temporarily, but the OTDA has said verbally to commissioners that it is their intention to keep this going. I think with a new federal administration coming in, I don't know how that might impact things, but I am hopeful that that we'll be looking at this being a long-term support.
Thank you.
But unfortunately, I don't have a way to guarantee that right now beyond what OTDA has sent.
Any other questions or comments? So Kit, this resolution came forth Budget Committee this morning, and there were concerns about it only being funded for a year. I think the other concerns were the grant goes from July to June, and how can we offer someone a position only guaranteeing them a one-year contract? I think there were concerns about that as well. So my guess is it's not going to be on consent in Tuesday's meeting, but I believe my colleagues from Budget will probably have some further questions.
So I can try to be on the meeting, Shauna, on Tuesday's meeting, just to try to speak to any questions. And it was my intention to come this morning to BCP and speak to it. And I apologize. I was kind of double booked already and then had a crisis. So I'm glad that you guys were able to discuss it, and I'll try to be there Tuesday to answer any questions.
That's great. Thank you. Okay, all those in favor of resolution ID 12969, please raise your hand. Okay, that's unanimous. Thank you. Our next resolution is to create the positions. And that is creation of positions, Family-Centered Case Management Services, Department of Social Service, ID 12968. Can I have a mover, please? Moved by Travis, seconded by Amanda. And this goes hand in hand with the other one. It just creates the positions. The other one actually allocates the funds and accepts the grant funds. Any questions or comments for Kit? Okay, all those in favor, please raise your hand. It's unanimous. Thank you. Kit, are there any other updates you would like to provide us with or comments?
I'll just let people know that currently we have, of the last couple of days, I don't have a specific date associated with this, but we have about 95 people in hotel shelter placements right now. And like I said, 12 children, 83 adults, and 15 on average. It varies a lot, but about 15 on average in the Code Blue shelter right now. So those are the only, about 110 total people in shelter right now. Those are the only other updates that I have. So thank you.
Sure. Any questions or comments? Okay. Thank you, Kit, and your staff. Okay, next let's move on. Oh, Travis Brooks.
Kid, at some point, I know it's not something you can answer today, so I have no expectation. Is it possible to send us what the cost is per week for staffing for Code Blue?
I can try to see if I can get that. Travis, it's a little bit difficult to get numbers like that on a week to week basis. But I know we had another request recently about, like, you know, what are we going to get? Where are we at in terms of how much funding have we spent? And unfortunately, I don't have a way to get that. We discussed that in one of our morning meetings, and we don't have a way to easily do that until claiming actually occurs. But let me see what I can do in terms of staffing cost and try to get you what numbers I can. Absolutely.
Thank you.
Sure.
Great.
I will. One other addition, Shauna. I just want to put out a shout out to the shelter staff, who I just have to say have done a marvelous job. They've really handled some very difficult situations and have done a really great job navigating it, and are working really hard. And I'm grateful. So thank you.
Great. Thank you. Okay, next we'll move on to the whole health department. Frank Krupa, and Brenda is here as well. Hi, Frank.
Hi.
And we do have a resolution for whole health, authorization for Tompkins County Whole Health Department to enter into a multi-year agreement with Camino Technology Incorporated for permit management software, ID 12971. Can I have a mover? Moved by Randy, seconded by Travis. And would you like to tell us a little bit about the resolution, Frank?
Sure. Our current permitting software is from a company called Excella. I told Greg Potter, our former IT director, I was going to give him a hard time about this for now until the end of history. But when we signed up with Excella, we hosted it locally. And that was the kind of the prevailing winds and what ITS recommended. About 6 months after that, everything shifted to the cloud. So we have been kind of working in this hosted model while the company has been building and developing their cloud-based version. So they've since told us that at the end of 2025, they will no longer be supporting hosted versions of the software. So it put us in a place to look and see what is out there. If we were going to have to make a change, it made sense to look at everything that might be out there. So staff did a review of multiple different systems, including Excella's cloud-based product, but they have selected Camino as the software product that they like to move forward with. We believe it will meet all of our needs and at a less expensive cost to the county. The reason this is in front of you today is it is a multi-year contract because they have agreed to maintain the annual maintenance cost level over those 3 years. And so we wanted to take advantage of that by offering a multi-year contract. So we would ask for your support to move to Camino and sign a 3-year with renewal contract.
Thank you. Amanda?
Yeah, thanks for the explanation, Frank. I guess I'm just wondering, was this something that would have needed an RFP if it's a contract?
Yeah, so this company is part of, Brenda, do you know the name of the?
It's part of a cooperative information technology agreement, which is acceptable to purchasing.
Oh, okay.
Yeah, so yes, in theory, we would have had to go to RFP, but several of the vendors were on one or other type of already established contract that we would be able to connect to. And so we have worked with finance, and they concur that because they are on that cooperative, we are able to contract with them.
Okay, great. Thanks for explaining that.
Randy Brown?
Yes, thank you, Frank. So is this in the 25 budget? Is there an impact there? And also, it says you're managing for permits. I assume there's fees associated with these permits that we're issuing, maybe for a water system or a septic system or whatever. Are those fees set by the state, or can we set our own?
They're actually set by the Board of Health. So we, each year before we submit the budget to the county administrator, we go through a process of evaluating our current fee structure and present that to the Board of Health for their review. There are some where there are minimums and maximums, I believe, set by the state, but generally speaking, the Board of Health sets those for us.
And there's no impact on our 2025 budget?
We budgeted for it. There was actually an OTR for both the implementation cost as well as the annual fee. We're hopeful that we might actually come in under those numbers, but we won't know until we get into the project a bit.
Thank you.
Any other questions or comments for Frank? Okay, all those in favor, please raise your hand. That's unanimous. Thank you, Frank. Brenda, Liz. Frank, do you have any other updates for us?
I do want to tell a quick story because it makes me smile every time I think about it. Some folks have already heard this, but we did open our mental health satellite clinic at Brown Road on November 12th with a soft launch, and it's been going well as we've gotten open and operational. But the story is around a family. There was a mother that had 4 young children that she brought to the building for one of the child to be able to see a therapist for their therapy appointment. While they were waiting, while the mother and the other children were waiting in our lobby, our staff said, you know, our WIC lobby is right over here, and they have toys and books and things for the kids if they'd like to use it. And in kind of transitioning to that room, they got into a conversation about WIC and if they had, if they were a part of it or were interested. And before they left that day, not only did their child get their therapy appointment, but the family was enrolled in WIC. And so that is a victory. It is the dream that kind of I and others envisioned as we talked about this merging together, was figuring out ways and facilitating so whenever someone entered our services, whatever service it was, we could get them connected to everything that would be available to help them be as healthy and safe as they can be. So I just wanted to share that. I know it's the tip of the iceberg. It's one instance, but it is what we all had hoped would happen. And it's already happened in the first few weeks of being open. So we're hoping to build upon that, create many more opportunities like that, and really have a system that supports families and really everyone in our community when they enter looking for services from us. So with that, happy holidays to everyone, and look forward to seeing you in the new year.
Travis?
Frank, thanks for sharing. I realize it's just one story, but it needs to be celebrated. That is the point, right? To help people, to be able to catch people, to be able to offer services to folks, and in turn, make their life easier and help take the burden off of what they're going through. And so often we always talk about problems and difficulties that we're having in the community. So hearing that is great. And, you know, I hope that you all have many more opportunities to do that and change people's lives. So thank you for sharing.
Amanda?
On a slightly different note, yesterday was Dominic Recchio's last day, our communications director, and at the little party they had, Lisa had scrolling down all the COVID updates that came to the legislature all those many months. And so we were kind of talking about that time and the intensity and all of that, and it was definitely a little bit of like, whoa, like looking at those slides and how, you know, we were all sitting in our little Zoom boxes, and you guys at the health department were giving, and the EOC were giving updates, and, you know, that it just went on for so many months. And I just wanted to acknowledge that and acknowledge that intense time and everything that, Frank did and everyone at the health department and our EOC. And it was, like sometimes now I think we're kind of back to normal and we don't really think about the intensity of that time and what we really went through. And so seeing those slides was kind of like, okay, that was a real thing that happened. And a lot of people put a lot of good work into helping others. So a few years later, another thank you for you and your team and everyone at the health department.
Thank you. We appreciate it. We do often, things come up and I think some of us have tried to put as much of it out of our mind as we could as we moved on. But yeah, there was amazing work that happened. And you mentioned Dominic, and if I could, I'd just like to share a few words about Dominic. He came into the EOC. Jason Molino hired him, and we were struggling to deal with communications. And he's like, well, he's not starting till next week, but I'm going to call him and have him come in today. And Dominic showed up and just started working. I'm not even sure he was being paid yet, but he was there, and he was the linchpin of all of that communication that went out. I had the information in my head, but he was the one that turned it into, with others' support, but he really led the effort to turn that into understandable, reasonable, well-received communications, and really helped us change behavior with that communication. So he was an integral part of that, and I'm so thankful that he came when he did and was a part of that. And certainly I'm going to miss him, but and I've already told him that he's probably my first call tomorrow to talk about some things we have going on in the city of Ithaca. So we're thankful he's not going far, but we'll certainly miss him as part of that team. And I just wanted to offer that and thank him for his help and support.
I feel like we're talking at his eulogy or something. Frank, I wanted to ask in regards, it seems like there are more overdoses the past few weeks that have been happening. Has your department been noticing that? There's overdoses, yes. We've unfortunately had a death as well. And we are working on some communications around the holidays because it's a difficult time of year for many of the people that are struggling with both mental health and substance use disorders. So we want to get resource information out there again. But yeah, this is a difficult time of year, and we often see numbers rise through January. So we're definitely mindful of it. Our partners are out trying to connect with people at risk, and we're hopeful that we can keep as many folks with us through the holidays so we can hopefully get them the help that they need. Thank you. Have you also noticed an increase in individuals that are seeking mental health services on Brown Road that are from the rural areas? Because I can imagine, I live right off of Warren Road, but it has been very hectic to go downtown to find parking. And I can imagine it's just so much easier to go to the Brown Road location for services.
Yeah, typically the first thing we hear is how easy it is to park. From folks, particularly families, because we're starting and focusing on children and youth at the moment here at Brown Road. So for a family that has multiple kids and trying to navigate all that, we've definitely heard positive response for that. I would assume that many of them are from the rural parts of the county, or at least the northern parts of the county. I don't have that data in front of me, but we can certainly look into it and get back to you on it.
That's great. Thank you. Any other questions or comments for Frank? Okay, thank you, Frank and Brenda and Liz, for coming to our meeting today.
Thank you all.
Let's go ahead and do our appointments, and then we will do our departmental updates. First off, we have our advisory board appointments. Office for the Aging Advisory Board, Carolyn Byers, at-large member. Term expires December 31st, 2027. Patricia Stam, at-large member. Term expires December 31st, 2026. William Lesser, at-large member. Term expires December 31st, 2027. Board of Health, Melissa Dindali, physician representative, term expires December 31st, 2030. Andrea De Lima, physician representative, term expires December 31st, 2030. Human Rights Commission, Lady Ajaya, Commissioner, term expires December 31st, 2027. Community Mental Health Services Board, Developmental Disability Subcommittee, Wala Maharam Horan, Mental Health Board Member Representative, term expires December 31st, 2028. Board of Health, Frank Cantone, at-large member, term expires December 31st, 2028. Can I have a mover, please? Moved by Travis, seconded by Randy. And all those in favor, please raise your hand. Okay, all those against? Okay, that's 3-1. That passes. And we also have minutes, November 30th, 2024. Can I have a mover, please? Moved by Travis, seconded by Amanda. Are there any comments, corrections to our November 20th meeting minutes? I see none. All those in favor, please raise your hand. Okay, thank you. That passes unanimously.
One more advisory board appointment. Second page.
I combined Frank Cantone with, okay, thank you. Sorry about that. Okay, let's see here. Why don't we go back to departmental updates, and Maury Josephson is here, who is our county attorney. I'm not sure if Maury has anything to report or if he's still at his desk there.
I am here. I have been listening. I do not have anything additional to report to this committee at this time, but I have been happily listening along to the meeting.
It's great. Thanks, Maury. Glad we haven't messed up anything so far. Lisa Monroe is here for the Office of Aging. Hello, Lisa. Good to see you.
Hi there. How you doing?
Good.
Good. Just a little short report, but we've gotten through our Medicare open enrollment, which is always a big program for our office. The last day was the 7th, so it's open enrollment's over for this year, but we continue to do HICAP, which is health insurance information counseling all year long. But the busiest time for us is open enrollment period. So that's done for this year. We're also participating in a 2-year project called the Healthy Brain Project. So this is a collaboration between SUNY Medical Department of Geriatrics and Syracuse University's Aging Studies Institute. And they're doing this in partnership with 7 offices for aging across New York State, and we're one of them. It's funded by New York State and Health Foundation of Central and Western New York. Our case managers have been trained to provide a screening to screen for early signs of memory loss using an evidence-based tool. So basically, if the screening suggests that there's possible memory loss, our clients will be referred to university geriatricians at SUNY Upstate for like a comprehensive geriatric assessment. Really the goals of the program or pilot, I guess you would say, is to evaluate the findings from the pilot itself, but also to create a training manual to broadly disseminate across the state. And we will then have the screening embedded in our comprehensive assessment that our case managers do for our in-home clients, just to be able to screen a little earlier for folks that we serve. So it's the newest thing we're up to.
Great. Thank you, Lisa. Any questions or comments? Amanda Champion?
I failed to mention this at our last HHS meeting, but I wanted to thank Lisa and tell the committee that there was a lovely event a couple weeks ago for home health aides. And I went to that, read our proclamation. Kathy Emilian was there from Anna Kellis's office and had a proclamation. And there was food and prizes for the home health aides, and people came with their families. And I think it was a really nice event at the Foundation of Light. And I think people felt, grateful to be honored in that way. And it's a very small thing for the work, for the work that these folks do. But It was a great event, so thanks, Lisa, for you and the other team who organized that.
Absolutely. Thank you for mentioning that, actually. It was a nice event. It's the first time we've done that event since COVID happened. Speaking of COVID, we're on a COVID theme today, I guess. So it was great to get back together. I think next year it'll be even stronger. Word of mouth is always helpful in those situations, so that we're doing it again. And we'd love to, recognize those folks for everything they do for people in the community. So thank you.
Any other questions or comments? Okay, thank you, Lisa. Appreciate it.
Happy holidays.
You too. Okay, let's see here. Next, we have J.R. Claiborne from Veteran Services. Hello, J.R. It's nice to see you're behind the waterfalls today.
We can dream, right? Just make it a good day. Good afternoon, everyone. Just in the way of announcements, really, my biggest thing is that this Saturday is the Army-Navy game, and we will be having our, we can now say annual watch party up at Longshot Sports Bar and Grill up in the Trip Hammer Mall. So this is, kickoff is at 3, so I figure folks will start gathering around 2:30 for our pregame warm-up, which is just the food's coming out. So this is something that will be free for our vets and their families with support from the Dwyer grant that my department administers. And then the other thing is I still have green lights, so anybody who would like to have a green light bulb to put out, this is something that we push in November, but it is something that can be carried on throughout the year. And lastly, I think some of you knew, this happened while I was gone. Word got out that my department received a proclamation from Senator Webb. I was trying to put it up, but you can't really see it much. But we got a proclamation from Senator Leah Webb for the work that this department has done for our community. And in part, she says here that we continue to honor the sacrifices. Our department continues to honor the sacrifices of our veterans by ensuring that they receive resources, compassion, and respect they deserve, strengthening our community and setting a standard of support and respect for those who have served our nation. So I thought that was a little something to share with you all, and I believe you may have also saw that. In addition to that, as the director, I received a commendation from Senator Webb as well. Which that kind of made my day in a good way. So that was something to receive that acknowledgement.
That's wonderful, JR. Thank you. Any questions or comments for JR? Okay, thank you.
And please know you're all invited up this weekend. So anybody who wants to come out, if you say go Navy, then I definitely take care of you.
I was going to ask if you're going to disclose who you're rooting for, but I don't think I have to ask.
Yeah, I'm a sailor. Got a picture of my ship here.
Very nice, very nice.
Yeah.
Okay.
All right, thank you.
Thanks, Jer. Okay, next we have Kate Shanks-Booth from Youth Services Department. Hello, Kate.
Hello, how are you?
Good, how's it going?
It's going, Shauna. So really just one thing that I want to focus on with you guys is to let you, and y'all should have received an email. Our office, speaking of homelessness, couple of the populations that we often overlook are 17 and under and the 18 to 25 population. And as many of you know, I'm sure we don't have any place to put youth under the age of 17 at this point in our community, which continues to be an issue. I am happy to report that Open Doors does now have 2 host homes in the county instead of 1, which is helpful. We had 2, we lost 1, and we've gained another one that was just confirmed earlier this week. But next Tuesday, the big announcement is next Tuesday, we are going to be having a Zoom conversation from 1 to 2:30. If you are interested and would like to attend, you should have received an email. If not, reach out to me and I can get you the link. And we're really going to be having, it's not just an opportunity for people who are direct service providers that are dealing with these particular populations to speak to local electeds and other folks, funders, some additional funders about what we're seeing, with the goal to hopefully create two groups that will focus on the different age groups, considering they're regulated differently by the state, and come out with some recommendations that will hopefully be able to help the legislature figure out maybe how we can work together and create a solution that'll help address that in our community. So looking forward to the conversation. So, and thank you, Shauna. You were one of the first ones to sign up, so we appreciate it.
Oh, good. Any questions or comments for Kate? Okay, thank you, Kate. Appreciate it. Okay, Cindy Wilcox is here from the Human Services Coalition. Hello, Cindy.
Hi, how are you?
Good.
I have a bit of an unstable internet, so if I get frozen up, I apologize. But I'll make it quick because I don't have anything to report other than happy holidays and happy eggnogging and favorite desserting for everybody over the next couple of weeks.
It's great. We'll take it. Thanks, Cindy. Okay, are there any comments from committee members or liaison assignment reports? Okay. I would just ask everyone to take a look at the budget adjustments and transfers at the bottom. And this meeting is adjourned. Thank you all. Have a great year. Thank you. New Year. Holidays.